Yeah.
Hello, everybody. Welcome to our podcast today for Out of the Ordinary, where we talk about health, nutrition, spiritual work, and auto-mysticism and biohacking. Today, we're going to talk to a very, very good friend of mine, someone who's got many years of experience in, we should like to call it light touch, but it's probably known to more people, Cranial Sacral Therapy. And the lady that we'd like to talk to today is Athena Pasialis. Athena is a good friend of mine who I've known for about good 6-7 years. We've actually done many natural therapy courses together. And I want to do a small introduction to Athena, who has a wonderful journey in natural therapy, runs her own practice. She's an iridologist, herbalist, and she also works with clients as another modality in cranial sacral therapy. So I'll introduce you to Athena. Hi, Athena.
Hi, Jill. So happy to be here with you.
Yeah, that's cool. Cool. So let's start with what is sacral? Well, let's call it the other way around. Cranial sacral therapy.
Yeah. So it's a way of just gently touching the body. There's specific holds that we actually do along the spine, on the head, on the cranium. That's why it's called cranial, and the base of the spine is called sacrum. So it's from the head down to the sacrum predominantly that we work. And we find that through a lot of trauma that we receive, whether it's a car accident, a marriage breakup, or it could be verbal abuse too, that person on the receiving end actually holds on to that trauma without realizing that they're actually doing it. And it gets trapped somewhere along the spine, in the vertebra in the spine, or in the connections that the small bones in our head have. So we think that our skull, our cranium, is like one massive bone, and it sort of is, it's united, but each bone has its own innate movement. And what happens when we go through trauma or stress and we hold on to that stress and it becomes trauma, there's the flow doesn't happen anymore. And so you end up with pain, you end up with tissues that have compounded over time, and then that creates health issues. So the thing with cranial sacral for me, it's actually probably the most sacred therapy that I do. It resonates with me on every level because, first of all, we're trained to take the Hippocratic Oath. So first, do no harm. And the fact that we use light touch, on the patient, we're not forcing any changes, we're not pushing anything. You're allowing that client to let go. And that's essentially the basis of it. There's other things that you need to keep in mind as well. But, when you compare it to, say, other therapies like chiropractic, where they find the issue and then they try through, massage and then cracking, they try to release that pressure. We can release the same pressure just through light touch, and it's phenomenal when you feel it.
Mm-hmm.
When someone tells you, you think, oh, how can that be? It sounds crazy. But I've been through so much trauma, over the course of my life. And the first time I had students, they were first-time students, put their hands on me, and my body started to release. I just thought, this thing is amazing. What is this thing? Couldn't understand it. And of course, over the course of that day and then the next 4 days, our instructor would explain that that's just your body's way of releasing, letting go of trauma that has been trapped somewhere in the body. And it's almost like that person that's giving the treatment is holding the space for you,
Mm-hmm.
holding that space for you to let go, almost like when you open up a soda bottle and you hear the gas being released. It's a similar sort of thing that happens, or phenomena that happens in the body. You don't know it's there. You don't know that you're holding on to this trauma. But once it goes, you know that it's left. You just feel this peace, and it's phenomenal.
Is it okay if you tell our listeners what sort of trauma that you've actually been through in your life, Athena?
Yeah, so probably 20 years ago, I was paralyzed from the neck down. I initially didn't know what was wrong with me, but through all the tests and whatnot, they found out that I had multiple sclerosis. So, I went down the normal route and, did the neurologist thing, and, I was injecting every second day, and, that would sort of leave me feeling like a bus had run me over. So I didn't know what was worse, feeling paralyzed or feeling incapacitated. So it was for like 4 or 5 months. I did that out of pressure from family and doctors and so forth. And then I was referred to my naturopath teacher, who I still see as a teacher. She doesn't treat me anymore because I treat myself. But I saw her, and the day I saw her, I stopped injecting and started taking herbs and the supplements. And then, I started delving into this world more and more. And yeah, within months I was better. And then I went back, and because I had actually started I had started learning about herbal medicine before I got MS, but I had a child and who wouldn't sleep, and it was just too hard to study. So then I found myself, probably 18 years ago, studying with 2 young children, building a house, and I was actually doing 3 courses at once. And so the fire was back into my belly, and I knew that I was on the right road. So I think once you've been through some sort of health issue or health crisis or journey, whatever you want to call it, it's pretty much what you do with it. Like, what do you want to do with it? For me, it wasn't enough for me to get better. For me, I actually wanted to give back to the community. So for the last, ever since I started, for the last 16 years, I kept studying, I've kept learning, I keep reading, I keep my mind open. And it brings me a lot of joy to actually help others find true health.
Mm-hmm, mm-hmm. Okay. What's it actually involve, Athena? Does it actually involve, well, you like to call it light touch, so obviously it's got something to do with a light touch, or
so I'll explain. This was crazy for me because I actually do Reiki as well, and Reiki helped me immensely when I was really bad, like badly paralyzed. I was doing Reiki myself daily. However, when I went to learn cranial sacral, I couldn't get my head around it because my teacher kept saying, now you've got to, touch the client without putting any weight on them. It's got to be really light. And so all I could feel was all this energy coming out of my hands. And I was like freaking out, thinking, oh my God, my hands are too heavy because there's so much energy coming out of them. And I don't know if I'm doing it right. And so I sort of said to him, can I try it on you so you can tell me if I'm too heavy? And of course, the whole class did then. And he kept saying to me, you've got to go lighter, Athena. Your touch is too heavy. So I learned that, it takes practice. And, when you do actually put your hands on someone, you can't actually lean, like put your weight on them at all. You've really got to position your body in such a way and hold your hands in such a way that you're not putting any weight on that person at all. But the effect is just mind-blowing. It's amazing to think that a light touch can create such an effect. is profound. And that's why I think it's so sacred, because you don't need, normally I need herbs, I need essential oils, I need powders, I need to get results with people. But with cranial, it's, you know, it's, yes, it's my light touch, but it's also the client. I have to tell the client they need to be present. So there's a few things that need to happen. So, and I also need to be present. So when I'm doing the treatment, I can't be working on, say, Udel and be thinking, oh, okay, so tomorrow I've got to call, you know, Sophie, and then I've got to do this, and I've got to do, it doesn't work. When I work on Del, my total focus is on you for that 1 hour. So what I say to my patients is, you know, this 1 hour is like a gift to yourself. So don't waste it by thinking about anything else. Just think about what you feel when I put my hands on your body. I want you to feel the blood flowing through you, or the energy flowing through you. And just put your attention there. So what another thing that we need to do, it's a must with cranial sacral, is you need to keep your patient present by talking to them. Because what happens, because it's so relaxing, people tend to, you know, really want to sleep, but you need to keep them present. You need to keep them awake if you can. So, you know, one of the best ways to do that is just to have a little sentence to say something to the effect of, hold your awareness on your physical body sensations. So it could be the flow of blood, it could be the energy, whatever it is. But I also find, through my own personal experience, I get my clients to breathe into my hands, wherever my hands are at the time. I get them to breathe into my hands. I give them something to do, and it gets their mind off whatever else they're. And I also find it helps to unlock traumas that are there. You know, they'll start to move. There's certain areas in the body where it's easier to get a release. And the two areas that I find that I work a lot with is the shoulder blades, or the scapulars at the back, and also your sacrum. So just the sort of the mid part of your bottom. So both of those areas hold a lot of trauma, a lot of stress. Yeah.
So
I've forgotten what you're.
no, that's good. That's good. So who else can benefit from it? I mean, you did talk about a bit of trauma, but who else can benefit from it? Like you did mention, what sort of trauma?
Yeah, look, a few years ago, she's a client, but she's also a friend. She rang me, and she's had depression for many years, and she's on medication, not herbal. She's on, you know, prescription drugs. She rang me, and she was in a mess, and she says, can I come for a massage? And I said, sure. But when she got here, I said to her, I think I'm going to give you some cranial instead. So I gave her cranial, and, you know, I got her to breathe and kept talking to her, because the thing is, you need the person to stay present, because if they don't, they can revisit that trauma. They can go into that fight or flight. And that's not what you want at all. So some practitioners or some students, I should say students, when I was assisting my teacher and helping him out, I found they weren't talking enough. So I'd go up to them and say, you need to keep them present. You need to keep talking to them. Oh, you know, I don't like to interrupt them because they're so peaceful. It's like, no, you need to do this. This is what's going to get you results. This is what's going to help them long term too. But yeah, going back to my client, I gave her the 1 hour session, and the first thing she said was, how did you know when to keep prompting me? And I said, well, I just felt that you were drifting off. So, you know, I kept prompting you. And she got up off the table and she said, I just feel this peace that I've never felt before. I don't know what it is. I don't know what you did to me, but she said, I feel like really calm. And she went to work, and she said to me later on that she just had the best day. She didn't stress about anything. She had all these issues coming at her. She was able to delegate. She was able to stay focused. So the thing with cranial is it enhances the function of the nervous system by releasing all these blockages, you know. So if you've got energy that's trapped somewhere along the spine, it's going to affect you in that area of the body, you know, and you're not going to function to your optimum. But it also supports and helps us to reconnect with who we are. It's almost like you drop this feeling of holding on to stuff, or yeah, I can't express that better, but it's almost like you find a better version of yourself after you have one of these treatments. It allows the boundaries or the things that you're holding on to unconsciously, because you can't see these things. You can't see, say, the DNA patterns that we've inherited from our parents and grandparents. You can't see that you might be, for instance, subconsciously holding on from your shoulders and your neck. And you see when people walk around with their shoulders up here, you know, where they should be further down. When you do cranial, those shoulders drop, you know, without, you know, it may not happen for people like that, may not happen the first time or the second time, but with a few treatments, they themselves, once they get to know what I'm doing, because initially when I put my hands on people, I know what they're thinking. They're like, what's she doing? She's not doing anything. She's not touching me. What's she doing? What is this thing? Is this really a thing? Like, does this really work? And I know they're thinking that because I thought that too. But let me tell you, you know, once you let go of those preconceived ideas of what is this thing, and you start being present, then you will start to see the benefits. During class, the first class that I went to, I had a lot of trauma that weekend. Like, there was a lot of stuff happening in my life, and I turned up and I was like in this sort of state, and I thought, I can't work on anyone. I've got to be worked on, because I felt like I was in a mess. And I had two people work on me initially, and my mouth that first day was releasing. It was going left and right so fast, like those old typewriters that, you know, you had to manually shift it across and right. They're like, you know. So my mouth was doing that for like 5 minutes, and I can't do that now if you ask me to. So my mouth was releasing, and after that episode, I said to my teacher, my God, you know, this is what happened. And after every session that I was worked on, I would have more trauma release. The next day, my mouth went up and down really fast. And then I found my bite changed, the way I spoke changed. It was crazy. But it was all these past, because, you know, yes, it was MS too, but I've had other things happen in my life as well, which were traumatic. And so all these things come up with each session. And I remember one of the students was like, you know, he couldn't feel anything. He wasn't having any releases. He wasn't having anything. He came from a science mind because he was a chiropractor. And he was like, what is this? Like, how come it's all happening to you? And, you know, I can't feel a thing. And I said, well, I joked with him. I said, you got to work with me, and then you'll feel something. And then we ended up working on each other, and he did feel it. But I think it has to work both ways. Both the practitioner and the client need to be present. If the client's present, the practitioner's off with the fairies, it's not going to work. Mm-hmm. They need to be. And so for me, I think because it had such an effect on me, I fell in love with it. It's sacred to me. And so whenever I get a client, I'm so grateful that they came to me. I give them 100% of my time. And I just want the best results for them.
Yeah. So going back to the, well, obviously we're both Greek, and we both actually have developed a belief pattern that whatever our parents have told us over the years, that's sacred and that is it. There is no variance to that. So a belief is a trauma. So light touch can help that, which I'm going to get your take on that. But there's also verbal abuse, sexual abuse, all those sort of abuses. They can be treated with light touch.
Well, yeah, I'm glad that you mentioned that, Del, because throughout the training that I did have with my teacher and the many times that I did go back to assist him, he would always ask the students, if they'd had any sexual abuse, firstly, because if they had, then you don't touch them waist down at all. And sometimes you can't touch them on their face either. Okay, so these things you need to ask the client, and that you don't need to know, what happened. You don't need to know for how long. You don't need to know any of that. You just know that you can't touch them in certain places. And also cranial sacral is done fully clothed. You're not naked at all. You just need to wear clothes that your body can move in, because sometimes you do have a release. Like for me, when I get worked on, like I probably look like an epileptic on the table because I do move a lot, but I really don't care. Like I didn't care who saw me because it just felt like my body was finding itself again, So I'll tell you a little story about a client that came to me. She was referred to me. She was probably in her late 70s at the time. And she came to me and she had been abused as a young girl for many years. So, and I knew, I was told that. So she was on a lot of drugs. She was on a lot of prescription drugs, not drugs recreational, but because she just couldn't cope with life. And she had other issues. So what I did with her is I just worked on her spine. And I didn't go all the way down either. I just worked, say, from the waist up all the way to her head, and then I held her head. And I could only work on her for half an hour. And she said to me, you can't touch me anymore. She says, I can't. Every time she came to me, it was only half an hour, and it was only the spine that I touched. So, yeah. Personal space, because some of the holds, especially when your hand goes underneath the sacrum, some people are not comfortable with that. So I never put my hands directly underneath their bottom, like, my hand and their clothes. I always put my hand between a towel, and I feel that allows for more, it's a little bit more, it's easier. Yeah.
Mm-hmm. Verbal abuse as well, you can treat that?
Yeah, well, I think with the verbal abuse, that takes time as well, because the thing is, a lot of the time it's because of the throat chakra. If they're all caught up in their throat chakra and they're not able to then stand their ground and speak their truth and get out of that verbal abuse, then it's just going to continue. So it's with the verbal abuse that actually takes counseling as well. Like I can do treatments, I can only take it so far, with the verbal abuse, because that's going to, if that keeps continuing, whereas usually with the sexual abuse, if that's finished and then they come and see me, then you can work on releasing all that trauma. But with verbal abuse, funny thing is that people think that it's not abusive, if you know what I'm saying. And especially if it's in an environment where they're living with the person, that continues to do it, it's an ongoing thing. So yeah, verbal abuse is a really tough one.
It's very tough, and it's actually very tough on the heart and the solar plex chakras as well. People just think
That's
it's just, yeah, there's a lot of emotional strain on all those chakras. Yeah. Okay, that's good. Have you got any sort of, I know you've told me a few experiences that you've experienced. What do, obviously, like when I'm doing my work with my clients in, say, shamanic work or my Reiki or whatever other modalities I do, I always do have a discussion at the end, sort of to let the clients have a chat and basically clear up anything they've got that they want to talk about in that. Have you got anything that your clients basically talk to you about after that, after your light touch, that's very common that they come back and want to discuss, or they basically experience?
Yeah, probably the most common thing they say is they just feel this peace that they've never ever felt before. They feel like they've meditated for like 4 hours, or it's sort of unexplained. Like they get up off the table, and I get them to sit on the edge for like 5 minutes and give them some water and just let them get their bearings. But it's like they're sort of got this, like they've woken up from a deep sleep. And yeah, some people say they feel taller. Some people say that, for the next week, they're just like buzzing, like, they just feel like they're walking on air. So it's sort of different for everyone. But yeah, I have some clients that come to me, and, with some of them, I say to them, don't tell me what your problem is. Just let me see what I find. And they say to me, how did you know I had a sore hip? Like, I didn't tell you, and I sort of check their energy. I start at their feet, and I feel if the energy is flowing down to their feet, and if it's not, then I move further up, and, I feel the blockages in my hands. So I just work where I feel, and I work through God too. I ask him, I say, okay, so should I go here or should I go there? And, and yeah, so he guides me too. But yeah, it's that piece. And I think, as humans, that's what we're all about. We should be walking around, feeling joy and being in love with life, and just, being an expression of that. But we've lost that ability. You don't walk down the street and smile at someone and they smile at you back because they think, well, what does she want? She's smiling at me. No, it's just hi, you're just saying hello. We're all, it's like quick, rush, do this, that. Everything's just, there's no joy in just being, just being who you are. And I think with the cranial, it can become an addiction. Like for me, it certainly is. Like if I can get a session anywhere, I'll go because I just love it. But that's what cranial teaches you, because in order for it to work, you need to be present. You need to slow down. You need to stop. You need to be there for the patient. You need to listen, stop, listen, and feel. And it's almost like teaching you, just let things flow, if that makes sense. I remember my teacher, the first day I met him, I was in this panic, and he just stood there, and I was doing all the talking like really, really fast. And he just stood there and he just looked at me. He didn't say a word. And then that made me even more nervous. And then he said, it's okay, like very gently. And I was like, oh, okay, I got to just stop. I realized. So it's about listening to the person in front of you, even though they're not talking to you. It's just being there and allowing whatever's meant to happen to unfold.
Yeah.
I know I sort of went off tangent there, but I just felt like I had to explain the listen and the presence. It's like a big thing with him, you know. You never, and I've learned this big time, you never ever, you know, make presumptions. You've got someone in front of you, you never presume anything. You always go in to a session with a child's mind, not knowing anything. And, you know, and then you trust that where you hold is going to be where it needs to be held. So I'll tell you about probably the biggest breakthrough I had with cranial, and it was with a good friend of mine who's also a client, and he got 3 teeth. He got hit in the face, and 3 teeth became loose. And so he went to his dentist, and the dentist said, look, there's nothing I can do. You're just going to have to wait to see if the teeth take or whether they come out. So I rang him and I said, look, come and I'll give you a session. And so, you know, he'd had cranial with me before. He knew what it was about. So I didn't have to explain anything to him, but I had to mind myself. Like, I had to be careful, because I had to stop myself from thinking, oh, Athena, just get the teeth back in. You know, like I work with my eyes closed most of the time. So I was, you know, holding his head, and I was like, no, don't ask. Just trust that where you're going to hold is going to be enough. You know, there's no force. There can't be any force. If you force, nothing good's going to come out of it. So in the 50th minute, his jaw just went backwards and forwards, and then he got up off the table and he started swearing, and I'm just like, oh my God, what just happened? Like, and he's like, you can imagine what he said. He's going, my teeth have gone back in. And I said, well, that's good. And he's like, I don't know how you did that. He goes, I don't. And I was like, yeah, thank you, God, because I work through him. It's not just me. And so, yeah, and I then proceeded to give him some herbs so that the nerves could reconnect, and also a powder that our teacher has taught us to make for mouth care in case there was infection, because the teeth had come out for 3 days. So, and I had seen a documentary on a boxer, and I can't remember who it was now, but his teeth came out and he put them back in, but then there was infection. So, he's still got his teeth. He's still got his teeth. And that was probably about, I don't know, 5 years ago, maybe 6 years ago. So that was my best outcome. Yeah. So
Athena, thanks for sharing that. Who
my
can't
pleasure.
get it done? Who, like, do you ask a series of questions at the start? And like, if someone has, say, for instance, cancer or bipolar or something serious, is it something that?
Yeah. So first, the ones that I probably wouldn't do it on is if they've been sexually abused very badly and they can't handle anyone touching them. There's no way you would force them to do it. And that's probably the limit. Like, the other patients, so you've got other people like autistic kids. They may not sit for half an hour. They may not sit for half an hour, but it would benefit them. So in that case, because I have done, he did do a course for babies and children, like, you know, doing cranial on a baby or a young child. And those sessions are not 1 hour. You know, they're going to be 15 minutes at a time, because the child's not going to sit. But it would benefit the kid if he's got ADHD or he's got learning disabilities. I haven't as yet done it on cancer patients. It's not the one thing that I would think of to do for a cancer patient. Although it would probably benefit, I still probably wouldn't do it, only because I'm generating a lot of energy and flow. And, you know, if you're wanting to shrink a tumor, you know, so I haven't at this point worked on cancer patients with cranial. So I can't really,
The reason why,
I'm less inclined to do it, because I don't know the outcome. Yeah.
Yeah, no, it's just good to know, because I know for reflexology, we've always got to ask the history of the client.
Yeah,
And with iridology, we can pick up a lot of things. So it's just general practice as being a practitioner, as you know, that there is a series of questions we need to ask. And I just want to
100%.
share you something with the cancer. So when I was studying Reiki, I had a very good friend of mine who's very, very close to my heart, and she's still there, which is my sister-in-law. And I remember when I was still practicing Reiki, I was doing my master's in me Reiki, and I went back to my teacher, and I'll never forget it when I said to her, Vic, this is the situation. I have my sister-in-law, and she's asking me to help her. And I had said to her, by then she was stage 4. They hadn't given her too long to live. So then I had to do some Reiki. And Vicky, my teacher, said, no, you're not to do that. And I actually, not through ego, it was just, I knew what I was doing, and I knew that she needed the help. She asked, she gave me permission to enter her space, and I did. And I actually did. And I remember when I went back to her, and I carried this, I healed her. Well, I was working on her for 7 months, even though they told her that she'd only have a couple of weeks.
Okay.
So I was working with her every day. And what happened was I went back to Vicky, and I said to my Reiki master, and I said to her, look, Vic, this is what's happened. I know you told me not to do it, but I did. And she got really angry with me. And to this day, I still don't know why she got angry with me. But then a couple of weeks later, I ended up had to do some work for her on the side. And she was actually proud of me that I did that. And I was a little bit confused why she was angry with me. Then she gave me permission to go ahead and continue doing it. So it's something that it's still in my mind. Yeah.
Yeah, I think it's because, see, with these healing therapies, you think that, okay, I'm going to do this and it's going to help the client, but it's very powerful. The energy is just, it's huge. Like when I work on a client, I've got like these, it's almost like a hole here and energy coming out of it. Like it's, and you know what I'm talking about. A lot of healers and energy workers get like that. So you don't want to give energy to the cancer. You don't want to promote that, because the body's confused. The cancer's growing in the body, shouldn't be there. But the cancer's calling for, a blood supply. The cancer's growing. The body doesn't realize that it's happening. So when you're healing, you don't want to be healing the wrong part of the body. So I think your teacher probably felt that. But sometimes it takes courage. Like in order to heal, you need courage. You need to stand your ground and you need courage. And you did that. You did that. You felt that you were doing the right thing. You were doing it from love, and not from ego. It was because you loved your sister-in-law and you wanted to do the best you could for her. So, no one knows everything. We're all learning, it's, and every situation is different. If I get a gut feeling for something that I shouldn't do something, then I don't do it. And I may have done it before and it may be right to do it. But if I get a gut feeling with a client that, they don't need that, then I won't do it. And I think, the more you work with people in this arena, the better you get at it. I think, your intuition just grows. So I think she was proud of your dynamic self, Del.
Well, I ended up being, without ego, her best student, and now she wants me to teach. So second half of the year, I'll be starting to teach, which is, so it's quite interesting. And that was 8 years ago. Yeah, it's gone so quick. Yeah. So, yeah.
Well, congratulations.
Thank you. Thank you. As you said, it's an arena. I want to know from you, you did mention gut feeling. Do you use any other tools? Because I know a lot of healers actually. So, for instance, Reiki, I don't know too much about light touch, but is that sort of channeled, or is it actually, are you basically a channel for this, or how's it actually, how do you see it? Yeah.
Yeah, okay. So, yes, and I know what you're saying, because with Reiki, you're actually a vessel and the energy comes through you and back out again. Now, with light touch, and there's a few different forms of cranial sacral. So some may say they're light touch, but what they actually do, and I'm sort of veering off the question a bit here, I know that, they do start off with light touch. So they put their hands on you, and then they start to shift ever so slightly. So they're trying to make a change. They can feel there's tension there, and they're trying to force it. They're trying to move it. They're trying to shift it. Now, with the way I was trained, and, you know, I do it exactly how I was trained. I know there's an issue there, and I can feel the energy's heavy and blood's not flowing. I just hold. You just hold. And no, I'm not a channel, but at the same time, there's no ego either. You know, it's not, I'm just there to facilitate the treatment. That's it. That's it. So with my client that had the teeth problems, if he had another cranial therapist work on him, he would have got the same results if they were present and if he was present. That's the difference. But I don't feel like I'm a vessel with cranial like I do with Reiki. It's different for me in that regard. And it seems almost very similar, because even with Reiki, it's not a heavy touch. It's heavier than cranial. It's heavier than cranial. You can actually, with Reiki, put your, like the palm of your hands onto the body and leave them there like this. And you can feel the energy coming up, right? But with cranial, I actually tend to go underneath the body a lot, because that way I'm not moving my hands, one thing, but I can feel a lot more for some reason. And yeah, I just hold until I need to. But I don't feel like I'm a vessel. The only difference that I've done, and I mentioned it to you the other day, was that I work through, and not always, but most of the time I work through God. So I'll start the session and I feel like I'm guided where I need to go. I feel like I do test. I start at the feet, and I feel, is there flow coming to the feet? Can I feel the energy in the feet? And a lot of times there isn't, because our circulation is not good. We're sitting all the time. We're not moving enough. So, but yeah, that's how I work anyway.
I know different healers have different techniques, and a lot of them, because our hands are very sensitive, and that's why we have our fingers to use, which a lot of people do not use and do not know the power of them. But yeah. I'll never forget, there was a student that, when I was doing my Reiki, there was a student there that she was an accountant, and she had the energy, she had the power to actually see through the body and could see the organs. She was amazing.
Wow.
And it actually scared her, and she couldn't finish a full session of when we sort of team up. She just goes, "What is that, Vicky? What is that? What is?" It's like she had no understanding of anything about the human body. She didn't know what a heart looked like. She was so detailed that she could actually identify. She goes, "Right there is like a little nodule there. What is that?" She could even see that there was an appendix. She was amazing. And she did not follow it through. She just wanted to just do the course because her friend was doing it. was amazing.
So
Oh,
almost
wow.
like X-ray vision. So people like that would be ideal to work in the medical field, you know, where they needed emergency, operations or procedures done, and they didn't have time for X-rays. She would be phenomenal.
And she's just an accountant. She was an accountant.
Yeah,
What she wanted to do.
but see, Del, no one is just what they do.
Yeah.
You know that.
Oh, yeah.
Everyone has a gift. It's just finding out what it is.
Yeah. And that's why we're all here. We're all here to find our purpose.
That's it.
I've changed the amount of times I've changed things in my life. I'm still changing when I'm 58.
Well, you've got a number of hats, I got to say.
Oh no, that's good. That's good. Yeah. So, wow, geez, I think we've had a good little chat about everything.
Yeah. Have I answered like all your questions?
You have actually, you have, and I think, yeah, I think we're.
I'll tell you another little story actually, because I love telling stories because it really like brings home results and gets people to understand. So I had this older man come to visit me many years ago now, and he was your typical European man, never had a massage, didn't know what cranial or reflexology or iridology was, didn't know any of that. So anyway, he comes in, I get him to lie down on a table, and I tell him, I just want you to be present. I just want you to breathe. I don't want you to fall asleep. And he had, what do you call it? Sciatica. That's it. He had sciatica. And he was actually, because of his family was forcing him to go to a physio, but he had no results, and he'd gone to the physio for like 4-5 weeks. So he referred to me, he comes, he lies down, I put my hands on his head, and I start to do the treatment. And then he's like, darling, he's like, it's not my head that hurts, it's my hip. And I said, I know. I said, just bear with me, just keep breathing. I just want you to, stay present. And next thing you know, his right foot starts moving. And then he's like, I'm not moving it. And I said, no, I know. And he's like, no, I'm really not moving it. And I said, I know, it's okay. Just keep breathing. And anyway, the session went on for an hour, and his foot was going like this and like that and like this. It just kept moving every which way. And he was really good. Like, seems like he'd never done any of these treatments before. He was really good. He breathed. He gets up from the table, and he wasn't, I don't know, my clients tend to swear when they get up. He started swearing in Greek too. And he's like, but you weren't touching me. He goes, how do you do that? He says, I go to this Asian woman and she kills me and there's no results. And he said, you barely touched me. He said, I don't understand. I said, it's okay. You don't need to understand. So I gave him 2 treatments, no more sciatica. So, and then he was skipping out of, like, he was not, man, he was skipping out of my office. It was like, I just had a smile from ear to ear, because I just thought, this is why I do it. It's just phenomenal.
Wow.
Yeah. And he wasn't taking any, herbs. He wasn't doing anything else different. He just came for 2 sessions and that was it. So, yeah, but it's creating, like I said to you earlier, creating that safe space. So, I spend probably 10-15 minutes before a session trying to explain and express what craniosacral is. And then I spend another, say, 10 minutes afterwards allowing them to sort of calm down and relax and come to. And the best way to do that after a session is to sit in the sun for 15 minutes and to stay hydrated. So I always book my patients in at the end of the day, never at the beginning of the day, because I don't want them running after they have a session. I don't want them sort of doing 101 things after they have one of these sessions, because I want it to last for as long as it will. And for some people, they might go home and go to bed that night, and they may release further. They might sort of jolt a bit or have an involuntary movement, and that's fine. That's just the body letting go a little bit more. But it's like a massage, you don't have a massage and then go and lift weights, or, go and chop a tree down. It's the same thing. You've got to allow the body to then settle. So, yeah.
Athena, yeah, sorry to interrupt. I just wanted to ask you, I know we say for acupuncture, because I've done a little bit of acupuncture in my time. I'm actually studying it now, so
I can see. I was just going to say, I can see you doing it.
Yeah, I just I've been in class where there's people who don't believe in acupuncture, and it just doesn't work for them. So you mentioned space a lot. People who don't go are not in that space, or don't believe what you're going to do is going to work for them. Does that got any role in when you're treating them? Do they still get a result whether they believe or they don't believe?
Yeah, look, the what do you call it? The placebo effect is huge, is absolutely huge. Yes, you need an open mind, 100%. You need to, I remember sitting in probably the second or third cranial class, and there were some really obnoxious people there that thought they knew everything. And maybe they were, really intelligent, in their field, okay? But you, starting in your class, just listen to what the teacher has to say. Listen and absorb it and try it and see. Keep an open mind. But no, they were closed. And the whole 4 days, they were just bad-mouthing it and saying, oh, this is, there's no, we're not writing anything down, it's all practical, what is this? It's like, well, yeah, cranial practical, I'm sorry, but we're not writing notes. You do keep clinical files afterwards for your client, but it's not going to work for that practitioner. If they give a session because they don't believe in it, they don't believe that it's got benefits, so it's not going to work for them or their client. I mean, even to the point, I can tell you, there's holds, there's holds for the face. I found after, the 4 days, my eyes would open up. So the muscles around my face would let go. So there was tension somewhere in my head. But after having, being treated again and again, my body would relax. It's anything, Del. If you don't believe in it, it's not going to work for you. It's anything. It's anything. And that's why, for me, sometimes someone is forced to come to me, or they, the family will say, you've got to go and see her, and for me, it's not about that. I say, look, if they want to come, great. If they don't want to come, don't make them come. Don't make them come to see me, because I want to get results for them. I don't want to just take your money, and waste my time either, because initially when I first started, we had to do X amount of patients for free. So I called some friends and family, and I would get them to come in for like 10 free treatments. So I think it was, 5 free treatments, 10 people, 5 free treatments, and to see how they progress. And, even from the beginning, when I knew nothing really about cranial sacral, they'd lie on my table, and I knew that they weren't present. I could tell. And I'd say to them, look, I want you to just not think about anything. Just focus on yourself. And I could see their mind racing. It didn't work for them at all. And then years later, some of them would come back and they would have a treatment and say, oh, that was amazing. And I said, remember when you first came to me and you lay down on the table and you had no results? And they said, yeah. And I said, you weren't present. And I tried to get you there. I can't make someone be present, but I tried to get you there, tried to explain it, to express it, but you weren't ready for it either. And this is the thing, not every treatment is for everyone. It doesn't resonate with everyone. But for me, if I could travel the world and do this, oh my God, that would be amazing, because unless you've had a really good cranial treatment, you really don't know what you're missing. And some people might listen to this and say, oh, I had one done and I didn't feel anything. Well, it's got to be the practitioner and the client both have to be present. And that's when you get that combination, it's like that's when the magic happens. And essentially it is. It's magic, because it's when things unlock. It's when things let go. You look at, say, cultures like the American Indians, where they build a fire and then they dance around that fire and they're barefoot and they chant, and they release whatever's inside them. They connect to the earth and they release. And we don't have that mechanism in our day-to-day life. We fall over and the first thing you think is, oh my God, quick, get up before someone sees me, because it's embarrassing, I fell over. And then you're bleeding or whatever, and then quickly you just get yourself organized and then you just keep going. But that's a trauma, and you didn't release it. You didn't scream. You didn't, if we could open a window and scream, but we don't do that even, so most people do have traumas and they don't even know they're there. And it's only when, someone's on my table. I've had clients that I've worked on and their stomach starts gurgling, and then my stomach starts gurgling, and I'm thinking, hang on a minute, I'm not hungry. Like, why is my stomach gurgling and their stomach's gurgling? And it's like the connection, because we're both on that same wavelength. And, I just think it's, like divine sort of timing. And then once the session finishes, my stomach stops and their stomach stops. And, and then, if I'm treating them for other things and I have a look at their eyes, I can see they've got, digestive issues.
I'll tell you a classic. When I was doing my Reiki 2, I was in class, and when I meditate, my right leg, my calf, starts to get itchy and starts to want to just like restless leg syndrome, but it's not. It just moves around. Vicky believes that in my past life, or a past life, my leg was cut off. And I said, possibly. So anyway, we're in class and we're in there meditating and that. And then I said, oh, that damn leg of mine. And I used to mention it to Vic, oh, that leg. She goes, how's your leg going down? I said, still, I just can't go into deep meditation because this leg is so itchy. It feels like I want to scratch it. Anyway, one day we were in class and then it just went away. And I went, and then at the end of class, we talk about, what we experienced and so forth. And I'm there and I thought, wow, it's gone. I don't have it anymore. Beautiful. Anyway, but the class already knew that I'd had this restless leg, when I go into deep meditation. Anyway, one of the girls turns around and goes, thanks, Del. I think you've given it to me. That was amazing. So she ended up getting it that night. Yeah.
Oh my goodness, Del.
Yeah.
You wished it away and it went.
I just went, wow. Yeah, but I've still got it, but it's fine. I just live with it. Yeah. Yeah.
Wow.
Yeah.
Yeah. I mean, I'd have to sort of, I don't know, I've never dealt with an itchy leg syndrome kind of thing, but, who knows? Eventually you'll uncover it, Del.
Yeah, I will. Yeah, cool. Oh, so how can somebody get in touch with you if they need to get in touch with you? Or
just through they can email me or just call me on my my mobile.
Yeah.
All
right. I'll put that on the link. Is that all right if I put it on the link down below?
Yeah, absolutely.
Oh, cool.
Yeah. I mean, I haven't been doing any body work now with lockdown. But once everything's lifted, then yeah, I'll be
Cool.
taking clients again for that. I've just been working remotely now, doing Zoom.
Oh, good. Oh, well, that's been great then today. Thank you for that, Athena. And
my absolute pleasure. It's been great chatting to you, and expressing my thoughts on cranial, and hopefully it's come through, like my passion for it, and
cool.
wish everyone all the best.
Yeah. Thanks, Athena. Thank
All
you.
right, Del.